Hey, future nurses. So it's been brought to my attention that a lot of nursing students don't really realize and understand how the NCLEX scoring is determined. So you know what we're going to do, we're going to talk about it. The NCLEX exam is a computer adaptive test. I need you all to understand this, and I need you to understand what that means when you're taking the exam. What this means is as you are taking the exam, the test adjusts based on the candidate's performance in real time. For example, if you answer a question correctly, the test redetermines the candidate's ability to answer the next question. So it's going to give you a more slightly difficult question. Similarly, if the candidate answers a question incorrectly, it's going to re-estimate your ability to answer the question and give you a slightly easier question. The minimum amount of questions you're going to get is 85, the maximum is 150, and you have 5 hours to do this. But I've had a lot of nursing students in my inbox so hung up on the score, or the question amount rather, that you got on the exam, and just automatically assuming you failed. Oh my goodness, I made it to 140, I failed. Oh my goodness, I made it to 150, I know I failed. Oh my God, the test shut off at 85, I passed. Let me tell you something. Stop focusing on the question number that you get to when the exam shuts off. Everybody just assumes that when you get to 85 questions and it shuts off, you automatically passed. That is false. While it can be true, yes, but there are students who have gotten to 85 questions and have failed. Similarly, there are students who get to 150, they go all the way and assume that they failed when in fact that they have passed. The bottom line is, it doesn't matter if you get 85 questions and out, 150 questions and out, and anything else in between. You have a 50% chance of passing and a 50% chance of failing. Once the test determines competency and the ability for the nurse to be safe, that is when the exam is going to shut off. If you're continuing to get questions, you are still in the game. So don't just assume that you got something incorrect or that you failed the exam because you made it all the way to 150 questions. Nursing students, stop stressing yourself out over the amount of questions. Oh, I'm 85 and out, I passed. Oh, I'm 150, I failed. First of all, start speaking life over the exam. And number two, understand that you can get any amount of questions within that range and pass or fail. So do your due diligence, have faith, and wait for your official results.